So the phase 2 study looking at the use of ruxolitinib before, during, and after transplantation for patients with primary or secondary myelofibrosis is being presented as an interim analysis of this multi-centered study. And we are presenting the interim results so far. So we plan to accrue a total of 48 patients, and we've accrued 26 patients. Of those 26 patients, most of them had intermediate and high-risk disease. Most of them had splenomegaly at the time that they were enrolled in the study. And most of them had additional mutations in addition to the JAK2 mutation. These patients have done pretty well in this study, and so the 1-year overall survival is 77%, with a 1-year progression-free survival of around 70% as well, and the 1-year GRFS, which is a GvHD-free, relapse-free survival of around 65%. So the primary objective of the study is actually the 1-year GRFS. And so we were excited about those results. In addition, we've also found that with using ruxolitinib at the time of transplantation and maintaining ruxolitinib after transplant, the rates of graft versus host disease are also remarkably low. And so the cumulative rates of acute graft versus host disease that's grade 3 or 4 is only about 4%, and the cumulative rates of extensive chronic graft versus host disease has been around 4 to 5% as well. And so we look forward to continuing the accrual of this study and also doing some more in-depth molecular testing to better understand what happens to patients with myelofibrosis in terms of their mutations before and after transplantation. So far we know the majority of these patients were JAK2 mutated, which is to be expected in a cohort of patients with myelofibrosis, as that is the most common mutation, but many of them also had additional mutations like ASXL1 and others, which is consistent with a group of patients that had advanced disease. And after transplant at day 100, we repeated next generation sequencing and found that most of those patients had lost those mutations, except for one patient that still had the JAK2 mutation, but interestingly, that patient is still in remission a year later. And of course, some of those patients that didn't have the presence of mutations by clinical next-gen sequencing still relapsed. And so we are interested in doing some more in-depth testing to understand, are there some small clones that are still present at day 100 that can help us to better predict who will eventually go into remission and who will relapse.